Hello, I am Dr. Steve Johnson, and today I will be discussing inference chaining in REBT. In Rational Emotive Behavior Therapy, we make a very clear distinction between what people think is happening and what they believe about it. Yet, in actual therapy sessions, clients rarely hand us their beliefs on a silver platter. Instead, they give us interpretations, assumptions, and conclusions about events. Inference chaining is the technique we use in REBT to move from those interpretations to the evaluative beliefs that are actually driving emotional distress. Let's start with a brief distinction. Inferences are interpretations of reality. They answer the question, what do I think is happening? For example, my boss deliberately didn't respond to my email. That person looked at me strangely. My partner sounded distant. These inferences can be accurate or inaccurate, but they are not by themselves what creates emotional disturbance. Beliefs in REBT are evaluations. They involve judgments, demands, or global ratings. Beliefs answer questions like, what does this say about me? What must or should happen? How bad is this? In REBT, it's not the inference that directly causes emotional and behavioral reactions. Inference chaining is a structured method for helping clients move from an inference to the belief attached to it. Clients often stay stuck at the level of interpretation. It means they don't respect me. It means I failed. It means something bad is going to happen. But those statements are still inferences. Inference chaining allows the therapist to follow the chain of thinking until a core irrational belief emerges, such as demandingness, awfulizing, frustration, intolerance, or global negative rating of self, others, or life. The purpose of inference chaining is not to prove the client wrong. In fact, we do the opposite. We temporarily assume the inference is true, even if it seems exaggerated or inaccurate. Why? Because disputing accuracy too early cuts us off from the belief we actually need to work with. Inference chaining answers the key REBT question. Given that if this were true, what were you telling yourself that created this emotion? The following is a step-by-step protocol for inference chaining. Step 1. Identify the inference and emotion. First, identify the specific emotion the client is experiencing and the inference connected to it. Always name the emotion clearly: anxiety, anger, depression, shame, not just feeling bad. Step 2. Assume the inference is true. Next, explicitly accept the inference as true for the purpose of exploration. You might say, let's assume for a moment that this interpretation is completely accurate. Step 3. Ask for the evaluative belief. Then ask a belief-focused question that ties directly to the emotion. What were you telling yourself about that which made you feel anxious? Or, given that interpretation, what were you saying to yourself that led to the anger? Step 4. Repeat the chain as needed. If the client gives you another inference, you repeat the process. You accept it as true and ask again for the evaluative belief. This may take several rounds. Think of it as peeling layers until you reach a belief that clearly fits one of the REBT irrational belief categories. Step 5. Offer a probable belief if the client is stuck. If the client becomes frustrated or can't articulate the belief, you may offer a probable belief, not as a correction, but as a hypothesis. For example, some people in that situation might tell themselves, this shouldn't be happening, and it's unbearable. Does that fit for you? Step 6. Stop when you reach a core belief. The chain ends as soon as you identify a clear core belief, such as, this must not happen. It's awful if it does. I can't stand this. This proves I'm worthless. At that point, inference chaining has done its job, and you can move into disputation and restructuring. Let's look at a brief example. A client says, my supervisor frowned during the meeting, and now I feel anxious. The inference is, that frown means I'm in trouble. We assume the inference is true and ask, if that were true, what were you telling yourself that made you feel anxious? The client responds, it means I messed up. That's still an inference, so we continue. If you messed up, what were you telling yourself about that which made you anxious? The client says, I shouldn't mess up at work. Now we're approaching belief territory. We continue. And if you did mess up, What would that mean about you? The client responds, it would mean I'm incompetent. At this point, we've identified a demanding belief combined with a global self-rating. That belief, not the supervisor's expression, is what's driving the anxiety. There are 3 common mistakes therapists make with inference chaining. First, challenging accuracy too early. If you dispute the inference before finding the belief, the client will defend the interpretation rather than examine their evaluation. Second, confusing meaning with evaluation. Asking, what does that mean to you, often just produces another inference. Instead, ask what the client was telling themselves that produced the emotion. Third, losing the emotional anchor. Always tie your question to the specific emotion you're targeting, or the chain will drift. Inference chaining is a precise but powerful REBT tool. It helps clients see that while they may not control what happens, or even how they initially interpret it, they do participate in creating emotional disturbance through their beliefs. Once those beliefs are identified, meaningful cognitive and philosophical change can begin. Thank you, and have a great day.